Hi, Jack. What'd you say, honey?
I said my mom is joining us.
Oh, yes, I am. Where's Joanne?
She's here, but her
Oh,
audio
there
wasn't.
you are.
Yeah, her audio is not working.
Oh, no.
Bad
Um,
timing, huh?
so what we plan to do is I can reiterate what she wants to say. She'll probably write it out in text here, and then we'll just kick off the meeting.
Okay.
Works. I'm fine with that.
We sold an iPad worth $505 for less than
So,
$24.
Getting started, I wish I knew a little bit more about you, Erin. I would love to like give a synopsis of like who you are,
as well as a
your
PlayStation 4 for
background,
under
your
$16.
story,
And
all
brand new
that.
cars for less than $900.
I mean, I can do all that.
Okay, hey, do you mind muting whoever
All auctions
has
start at $0
sound in the
and
background?
everything must go. And don't forget, we offer a
You want me to mute myself?
Please.
Oh, sure.
$20.
I don't know how. Okay.
Welcome, everybody.
Hey.
Today, our guest speaker is Aaron Radspinner, and he will be sharing his story and his Danielle is joining. Hello, Danielle.
Hello.
Hi. Welcome.
Thank you.
All right. Well, I wanted to introduce Aaron to everybody. He is a chiropractor out of Portland, Oregon, and he will be sharing his story today. And I know that he had mentioned that he was going to be talking about the possibilities of, how to work inside the body and help realign yourself. And he will take it off from here.
Perfect. Well, thanks, Jacqueline. Joanne can't, her mic's not working, unfortunately, so she's just making hand signals in the background. But we'll cover for her. Yeah, my name's Aaron Radspinner. I'm a chiropractor in Southwest Portland, and I figured I'd talk about stress today. It's one of the things I keep seeing with all my patients coming in with their shoulders up around their ears. We're living in kind of weird times right now. I mean, even if your life is kind of normal, it's still weird, right? We're wearing masks and people don't know how to interact with other people right now. So there's a lot of tension. There's a lot less connection. So I'm going to talk about different ways to handle stress. I look at the basically as your body as like a cup of water, a big giant cup. So if you can imagine this cup here, and that's how I view stress anyways. As we add physical things, let's say a fall, an injury, pain somebody's having, it starts filling up. You add in emotional stress, like work problems, relationship problems, that adds up. You add in chemical stuff where they're not eating right. It's one of Jacqueline's specialties, getting good quality nutrition into your body. It all fills up and then it overflows and then people have problems. So that's kind of how I view it. So if we can do things to bring this level down, you're going to function better. So one of the things I'm always focusing on in my office is the physical causes. We have things where like traumas and parts of the body that don't move right. I mean, if you have your body where your joints and they're stuck and they're not moving properly, it'll start driving your stress hormones. So as a chiropractor, we're always looking at getting motion right, making sure the body's working right. There's a lot of things you can do just on your own without needing a chiropractor, just to get your body feeling and functioning better. I mean, one of the things is moving. A lot of people don't realize how much they need to move. You should move daily. And for some people, it's a hard thing. I have patients that really they struggle to get out and get exercising. I recommend, if someone's really having a hard time and they're not allergic to dogs, get a dog. It'll make you walk. I mean, get a cute little dog and it'll love you. Or if you have allergies to animals and your situation doesn't allow you to have an animal, I mean, just put your workout clothes on daily. You don't have to work out. I've told my patients a lot. You don't have to work out. Just put the clothes on and just sit by the door for a little bit. Even my hardest patients who won't do it, they'll still do it and they'll eventually start doing it. So I mean, if your body allows you to do that, just definitely get something moving regularly. The movement they found brings your stress hormones down. Your body really needs it. It's not like it's something that we can choose to do. We really need to exercise. And you know, some people have a hard time with it, and you know, that's why one of the reasons I think CrossFit took off so much was they would schedule it, or yoga classes where you have to book online, because people would go to them and they'd show up. So if they didn't show up, they'd lose their spot and they would get dinged for it. So anything you can do to make a positive habit, you know, out of something like that where you can schedule, I'd recommend doing something like that. The other thing I look at a lot with patients is how they eat. You know, I was looking at one of the studies recently. They were saying three out of four reasons that people go to the hospital for hospital visits are due to stress-related things. So like, you know, they get shingles, or they get something where they get rashes on their body, or they have things that happen from carrying around all this stress and not having a way to an outlet for it. And I think that's really important. You know, one of the things I do like is making sure you're getting more good quality vegetables and raw foods in your diet. I agree with Jacqueline. She's awesome. And I love what she's doing, because that's going to lower your stress hormones. I mean, a lot of times, I know if you guys feel this way, but I know when I would get stressed in certain times of my life, I tended to eat more fast food. That's like the opposite of what I needed, you know, but I would feel way better when I would eat really good quality food. And eventually it starts clicking in your brain as you start doing it. You're like, you replace the negative with the positives. And I've had patients too that, you know, they work at a brewery or something, and their habit has been to like start drinking a lot, you know, because it's around all the time. And one of the ways I've helped people to kind of just change up some of the habits is, well, every time you have a beer, have a big glass of water, you know, and then they're like, I only drank 2 beers last night. I had 4 waters, because you can start adding in the positives. I mean, I'm not a big one of like, you can't have any chocolate cake, because then I feel what I've noticed with me and other people is they really want it more than. It's like, don't make it such a negative, just add in more positives, and the negatives tend to fall away easier. So with everything I'm doing, you know, in my life, I try and do that as well. So exercise, the emotional thing is a big component. I think it's overlooked for a lot of people, because when you think about like the stress we put on ourselves, you know, and just the weight we put on, you know, with mental weight we carry and stuff, like different things we're doing in our body, having an outlet for that, I'm a really big fan of. You know, that's why I like getting out in nature, you know, walking. It's kind of meditative. If you're a person who has a hard time meditating and just sitting there and being quiet, that's a practice I definitely recommend looking at. There's a book I read called I think it's called A Miracle Morning. It's a super thin book. It's so good. I got one of my patients brought it in, and I've done stuff like that in the past, but he breaks up his morning routine where he basically does an exercise for like 5 minutes. He reads for 5 minutes, something positive. And then he meditates or prays for 5 minutes. I mean, you can put in wherever you want, but it's something positive. We're thinking about, goals in your life or things you want to change, or, but thinking of it in the positive. It's a great book if you want to make some. It seems super simple. It looks like Joanne's shaking her head. I probably read it before. Yeah, I highly recommend the book, and super cheap. Amazon, I'm sure it's probably $5-10, but a really good book for that. But adding those positive things into your daily habits makes a huge change. One of the things that I do see a lot is, especially now with the masks, I mean, we're all wearing these masks everywhere. I notice a lot of people aren't drinking enough water. And as we get more dehydrated, everything in our body starts functioning at a lower level. We need the water in there to detox. Our joints are mostly water. They're about 70% water. So if you're dehydrated, your joints start shrinking. And what can happen is when they start shrinking, they become more painful and achy. So that's where movement's so important, but also keeping good nutrition, good food in there as well. And when the spine, from like my perspective, what I see is when the spine doesn't move, it drives your stress hormones. So joints that start getting locked, it doesn't function well, and it starts driving all those hormones in your body, which they're basically the catalyst for a lot of disease processes. So that it's not the whole, I'm not saying that your spine being locked up is causing all your disease in your body, but it can be a catalyst for more problems. You can drive more heart problems, more just gut health, all kinds of stuff we see. I mean, it's amazing what the symptoms we see with patients. So, well, I don't want to take up too much time. Is that 10 minutes, or should I keep going? Or okay. I don't want to make sure I don't overrun it. Yeah. So one thing that that I've always done with patients when I've had shorter times to talk is I do offer a chance to come in and get looked at if anyone wants to take advantage of it. What we're doing, we're doing a thing for we're raising money for turkeys for the food pantry. And so normally we do our exam, we have an ad out on Facebook right now for $39. That would be a complete exam with any x-rays. What we're doing this month, well, starting today, we're donating the money to to get turkeys for needy families. So if somebody wanted to take advantage of that, that's what we do. We donate the $39 for turkeys, and hopefully we can get a bunch of turkeys for people.
That's awesome.
Well, it's Thanksgiving, right? We gotta, yeah.
Yeah, totally. I think that's a good cause.
Hey, we'll try it. Yeah, I think it's awesome. Well, I mean, there's a lot of people, there's more people now that need help than there have been in the past. Because I mean, some businesses are doing great during this, and some are really struggling. And I'm seeing it in my patient base, where some are just struggling. Their jobs are changing. We're seeing some of the big companies in the area are, doing a lot of restructuring, with like Nike and Under Armour and Columbia, and a lot of them are just doing some restructuring. So we're seeing patients that are maybe feeling a little more stressed than normal because their jobs are not sure what's going to happen, But the body's amazing.
Question Joanne has mentioned, that's really great.
Yep.
If we're already a client, can we just donate the amount?
Sure, for sure. Yep.
Cool.
Yeah, and any amount too. It doesn't have to be a specific amount for that. I mean, you're already a client, so I can give you the info. We're going to bring in some flyers in for it. It's a great cause, Yeah, thanks.
Definitely. And then she also had another comment she made. Also, can we take advantage of your service online?
So what do you mean by that? Like to schedule or to?
Yeah,
Oh.
Joanne, will you elaborate? I would love to know as well.
I do virtual consults with patients, and we've done a couple of those, if that's what you're asking about.
Okay.
And then usually what I'll try and do, because, as a chiropractor, my job's really physical. I kind of have to do work to, yeah, I definitely do consults online. Yeah, for someone I had a lady who's in a wheelchair. We just did a consult online. She's had trouble getting in and out of the office. So I try to make it as easy as possible. And then I still need to see her in person for the visits, but we can do the consult online. Yeah.
Yeah,
sure.
that's wonderful. I do have a question for you, Dr. Aaron Radspinner.
Yes.
Do you have a criteria for determining how many visits somebody will need?
Yeah, so it depends on what we're doing with them. So someone who has a healthy spine and just has some aches and pains, it's usually going to see them as you need to see. So I look to make sure all the motion's going properly. If someone's got their spine is not in the right position and things are really deteriorated where we're seeing more degeneration, then typically what I'll do, it's usually gets more involved depending on how much care somebody's wanting to do. I mean, it's kind of like the care we do, if you go really advanced with it, is kind of like braces on the teeth. It can get really involved. And it depends how far you want to take it. I mean, some patients just don't want to go that far. They don't want to do the exercises and stuff. So we basically work with them too. I usually do re-exam to re-exam. So that's every 12 visits. We check in again, see where you're at. If someone has a really big issue, it could be like a 90-day thing. If it's a smaller issue, it can be less.
I have another question.
Sure.
Do you have people that come to you that are not in pain that you would actually treat on like generally?
So I have a lot of the athletes I work on, a lot of the hockey kids, well, not hockey right now because they're not playing, but unfortunately. But I do see a lot of athletes and figure skaters and stuff who want to get full motion in their hips. They have no pain.
Okay.
But they're looking to make sure that when they jump and they do their, all their spins and stuff, their triple axles, and most kids are crazy what they can do.
Yeah, no doubt. I do have another question. Now that I've been thinking about all this, what techniques do you typically practice?
So I do the technique I mainly do is a posture-based technique. It's called chiropractic biophysics, and I mix it with Pedabond that I've learned over the years. And it's a lot of reshaping the muscles and tendons and getting the joints in the right spot and then strengthening it all where it's supposed to be. It's what really got me results because I had a pretty bad crash when I was a kid. Well, lots of crashes on my BMX bike and skateboarding and stuff I did as a kid. All the fun stuff. But I was a mess.
too.
I had a lot of back pain where my leg was giving out, and I would go to get up and my leg would give out and I would drop. And it happened at 21, and they told me I needed surgery. So I had scheduled the surgery, and my brother-in-law over the holiday, we were waiting. He's like, don't do it. Because he had 2 surgeries and he got worse after each one.
Mm-hmm.
He's like, I would try something else, anything else. And he's like, I would try a different kind of physical therapy, because I'd done physical therapy for about 6 months. He's like, I would try chiropractic, I would try acupuncture, and the chiropractor I met helped me so much that that's why I started doing that technique, because it made a big difference. And
Awesome.
we do low force adjusting too. I have a low force instrument that we use. So if I'm working on little kids or someone with joints that are just deteriorated, we'll definitely go lighter. You don't have to wrestle with everybody.
Yeah, definitely. So I've been to your office before,
Yep.
and there was a tool that you used on me. Is that one of them?
Yes. Yeah, the Arthur stem. It made it sound like a woodpecker.
Yeah.
Yeah, it's a good tool. It helps move the joint without having to put a lot of force in there. It's what I'd use if I had to adjust, like, let's say, a dog or a little baby, or someone who's got problems and they're sensitive.
Oh, yeah. That leads to my next question. It'll be my last question, so others can ask you. Is there anybody you cannot treat?
With the instruments, so traditionally, we x-ray in our office, most people. And the reason I do that is you can see stuff that could be a problem. We use a high frequency digital x-ray, so it's low radiation. It's about the same as you get flying in an airplane to Seattle. And what it does, it allows me to see all the joints, what's going on, and then I look and make sure the ligaments are all strong. But as far as anybody I couldn't treat, I have had a couple patients who've had fusions in their neck. They got plates in there and they got and screws and stuff. And other chiropractors wouldn't treat them. I can work on them around it. I just you can't work on the bone. There's sections I can't treat, I should say, but not people,
Yeah. So do you work on, you said you work on younger children, or more like junior high, or is there any age group that you don't?
My biggest patient right now is 1.5 years. So, but I've done them. We have the Women's Health Center that's referred over babies that were breech and maybe they're having, they had a rough birth and they're not latching right. And sometimes there's stuff you can do with the palate of their in their palate.
Wow.
Yeah, or upper neck misalignment.
Good to know.
Yeah. So, yeah, I've just both my kids when they first came out.
Danielle wants to know, what was the name of your treatment style you used?
It's a mixture of 2 different techniques. It's called chiropractic biophysics and Pedabon. It's a posture-based technique. And then the other technique I do is called torque release, which is the instrument-based technique.
And Joanne has a few things that she wants to mention, and I will be sharing that part for her.
Perfect. She's typing.
I think she is. Yeah, that's so cool. I have a few friends that are pregnant, and I've actually thought of you because I saw a pregnant lady leaving your office the other day.
Yep. So we get a lot of pregnant moms because their backs hurt, it starts putting a lot of pressure back there. Yeah. There's a technique we do called the Webster Technique that helps if the baby's breech and isn't turning. That's mainly what we see a lot of pregnant moms for too. So
that's so cool.
Not invasive. So
okay. Now Joanne wants to tell you thank you graciously, Aaron, Dr. Aaron, as this has been a very interesting Zoom session. Thank you to the technology.
It's not stressful, right?
Not stressful. And I'm just waiting on Joanne to let me know what she wants me to share. Since we are talking about stress, she wants to offer a few things from Arbonne.
Okay.
First are some of her favorites. Joanne, do you want to, I was wondering if you wanted to share your screen, but it might not be on your computer. I was just realizing because you probably have the products in hand. First is her lavender oil, which she was slathering on at the beginning of this session
Yes, she
because
was.
her audio wasn't working. And why is the lavender good, Joanne? What is the benefit? It has a property of bringing a sense of calmness, she has said, which is true. It is used in a lot of holistic therapies, and for instance, it is used to reduce symptoms related to stress. It can also calm the mind, and it can also cause you to become a little bit more sleepy. And is the lavender oil, does it have a carrier oil? The next thing isn't just essential oil of lavender that she's aware of. The next item is called Inner Calm. It's also something that we have found is awesome to bring some inner calm. It's added to water and then you shake and apply. I would love to know if you have links for these products that will go to your actual website. And what we could do is we could actually click on the link and share the screen maybe. She will be having her detox tea right after this. And it will be so relaxing. I'm not laughing at you, I'm laughing with you. Okay, Joanne is raffling off some prizes. And so please comment or ask questions, and she will always choose a winner from those who participate or that show up. Just for fun and for tuning in. And how soon will you be doing the drawing, Joanne? In 2 days? 48 hours. Okay. And that goes for the visitors who watch the replay as well. Awesome. Can I ask if anybody else has any questions for Erin or for Joanne tonight before we close the session? Okay, well, that wraps it up. Joanne has thanked me and you, Erin, and you guys rock, she says. Thanks for rolling with her tech issues. You know what? We're all in this together.
Well, thanks, guys. I appreciate it. Super fun.
Definitely. Thank you.
Yeah.
I was so stoked to learn a little bit more about what you do.
And if anyone wants to get a hold of me, should I put it in the chat? Will that best way to do it? Okay. I mean, if you have questions, I mean, I'm happy that you can email me or text me. Either way, I'll put it down here.
Cool. You are so awesome. Okay, I'll add my information as well.
Okay, perfect.
And I put my email for you guys to contact me so I can relay any questions that you might have.
Perfect.
And thank you so much, Joanne, for hosting. And we apologize for the audio and the technical issues, but we got through it. And thank you, everyone else, for joining us tonight.
Thanks, guys. All right. Bye.
Bye.